I want to really work on this one more. So this is where you can, again, bring that fancy tool out that Dr. Nick has. We've got the Ninja Star one here now. So I like using the thumb angle for it, so it's not as pokey. But I'll go in there and load in, find piriformis, find all those internal rotators. You've heard of the term P-Go-Go-Q. It's a great way of remembering what those are. So you've got piriformis, you've got your gemellus, and then you've got your obturators. I don't know if you guys have heard that great term, but it's helped me memorize all those ones.
Yeah, we just learned them as the PSO-IQs.
We've got all our funny ways of remembering things. All right, so what I'm going to get you to do in a minute here is we're going to switch to sideline. So I've just got Drew's back draped here. You can see it from the top camera. I just tucked right into the underwear. This is going to let me go into QL again. So now you can see that there's less resistance. You can see my hand sinking right through. If you look at that camera, you can get into the QL a lot more here. So this is just, again, a little bit more passive. We're not making him move yet. You're kind of feeling things around, seeing if there's restriction in certain spots. So what I like to do is after I've worked through this area, I'll get Drew to bring his leg off of the table. So his top leg, just bring it right off the table, let it hang. This is typically easier if your patient is dressed. I'll do this with a lot of people when they are done and off the table and dressed, if they've got stretchy pants on, but it lets me get into that QL a lot more. So what I'm going to do is I'm going to load into QL here, make sure I'm not in the way of the camera. And then I'm going to be pulling the leg back, it's extended towards me more, and I'm going to be pushing it down so we're getting a stretch through QL. This is usually where I'm watching for patients' faces or body twitches, but he's not giving me anything. Good, okay. So it is restricted in that spot, it's feeling a little tight.
Yeah, it's pretty good for sure.
Are we getting referral with that at all?
Yeah, it aches a little bit down to the iliac crest and towards the side.
You okay with me holding it for a bit?
Yeah, in a good way.
Okay.
Yeah.
Trigger points are great. They're good keys that you're finding the right spots. And I felt that release. So what a release would feel like in this position is his leg just dropped a whole bunch more. It was able to just relax and go deeper into that stretch. Something you can do as well is you can start making him do some work. So I'm going to get you to push your leg up against my hand here. Yep, good. Hold it for 7 seconds. 7, 6, 5, 4, 3, 2, 1. Good, relax. And get a deeper stretch. Good. And one more time, push up. 7, 6, 5, 4, 3, 2, 1. Good, relax. Good, exhale. Breathing is important in treatment, and I sometimes forget that, to tell my patients to breathe and relax with each pin and stretch, so that was good. You can use, of course, Dr. Nick's awesome tool for that. I'm just going to bring your leg up. You can work right into that area again. So again, using this one is what I like to do. Using that thumbprint, again, it just hooks into there, and it takes no pressure off of my fingers, right? It's nice and easy. What is that pressure like for you right now? Is it pretty easy?
It's a decent amount.
I don't feel like it's anything.
Yeah.
So that's great.
But very specific.
Good. So I like typically using my hands first so I can feel that area, and then I can go in with that tool now that I know what the structures are kind of feeling like underneath. All right. So with low back again, what I like to do is, if I may, take this arm. I'm going to stretch it right over top of your head. Get a good lat stretch in there. Lats are important. Don't forget our lats. So I'll do a little bit of Swedish through here, stretching that thoracolumbar fascia that's got that big, thick connection on our low back. And we can use, again, that tool that Dr. Nick has. So you can go right through our lats and strip through that all the way down to our iliac crest. Always check in with your patient if you need to back off. Are you doing okay?
Yeah, that's fine.
All right. So I would do this both sides, of course, but what we're going to do is we're going to switch now to face up so I can work on his hip flexors. I got you. All right, so always do face up treatments because laying face down for a long period of time can get really uncomfortable on a patient's back if they've got low back pain. So what I like to do is include our hip flexors. Earlier I mentioned things about similar like our lower cross syndrome, okay? So we've got tight hip flexors and tight erectors. We need to include those in our treatment if